On the BC CDC website, it talks about how children are at low risk of catching and spreading the disease, that children who develop it are less likely to spread it than adults. With the rising cases, the percentage of cases with kids, can you kind of speak to the research that has led to that assumption or conclusion that children are not they don't spread it as much as adults?
Yeah, so this is an ongoing area of research and investigation around the world. And the paper that you're referring to, there's a number of them up there on the BC CDC website. We do what are called rapid evidence reviews. We align with what we see from other agencies as well, and collectively around the world, there's a reference list in that evidence review that you can look at what some of the papers are. But the evidence shows particularly young children under the age of 10 are much less likely to shed virus, much less likely to have severe illness, and less likely to pass it on. And that still holds. We know that as children get older, there's no magic age, so it depends on the child, and we can't say these things categorically. But as we get older, we're more likely, so teenagers are more like younger adults, still lower risk, and a lower percentage of the cases relative to the population. So we've been monitoring that quite carefully, looking at the percent of the population under the age of 10, the numbers of kids who are getting infected in that age group, and it's still underrepresented. So what we see in our data here bears out with the evidence that we're seeing from places around the world. It's an ongoing, evolving thing, but right now that still is the evidence that we're seeing.
Graham, do you have a follow-up?
Sure. So what does it mean that before September 10th, 9% of COVID cases in BC were between ages 0 and 19, but now in the past week, 12.5% are. And in Ontario, that rate has gone up to 15% from 7.8% before schools opened in Ontario.
Yeah, so it's a reflection of a couple of things. It's a reflection that we're actually testing kids a lot more. So we presented some of that on Monday. In the younger age group, we've gone and we've tested 4 times more children than we did before. And this is because we're monitoring them more carefully when they're in the school system, and we have these processes in place to make sure kids can get tested. So that's an important difference. But if we look at in BC, there's still less than 10% of the cases that we're seeing, and that has held steady. And we've also seen that they are underrepresented still, proportional to the population of that age group here in British Columbia. So I think it's a combination of things. It is reassuring that we're doing more testing, and still with the testing that we're doing right now, the percent positive is very low for children under the age of 19. So of the, it's about 7 in 1,000 who are, these are children with symptoms who have been tested, turn out to have COVID. So that's still a very low rate, and that reflects as well the low rate that we're seeing of COVID in our communities. That doesn't mean that every single case doesn't need to be followed up on, and we do what we need to do to investigate and to see where they got it and to prevent ongoing transmission. But it is a reflection of the fact that this is spread more easily in certain environments. And those environments tend to be places like long-term care homes, where a lot of people are in crowded places together. So we're not seeing explosive outbreaks since our schools have been open for a month now. But just on testing, I neglected to say, we did over 12,000 tests in the last 24 hours. So 12,052 tests, and of those, 109 were positive. So our percent positivity, and these are people who we're targeting to be tested, people with symptoms, is still less than 1% right now. So that gives us a good measure that we're holding our own in the community here in BC.
Just wanted to ask you about education in schools again, and what harm could come from the public knowing exactly the number of students and staff that are linked to exposures in schools across BC, because Alberta's already doing that, and I'm getting inundated with emails from parents who are saying, why can't we just have specific numbers about a possible exposure in our school?
There's a whole lot of things around schools, as you know, that are being followed up on a day-to-day basis by the regional health authorities and by the public health teams. That's not information that we collect on a day-to-day basis in a way that can be aggregated, but we can look at having it periodically in terms of what percentage are students versus staff.
Do you have a follow-up, Marcella?
Yes, just regarding the confusion and the mixed messaging that we're getting about why runny noses and sore throats are no longer part of school entry checklists, we're seeking more clarity because the same rules don't seem to apply for children and staff. And while that may be obvious to medical professionals, it's not to the rest of us. And it seems to contradict the ongoing recommendations for everyone, including teachers, to stay home if you're not feeling well.
Yeah, and it is very much based on evidence and data that we have about what symptoms are associated with COVID in young people. So it is for students, and particularly for elementary school students, most importantly. And we're talking about single symptoms. So I just wake up with a bit of a scratchy throat, or I just wake up with a runny nose. That's when we know that parents know their children best. And if they're concerned, they should keep them home for 24 hours, see what happens, see if it gets worse or if it resolves, and then they can go back to school. So that's and it's based on the data that we have. I mentioned that it's around 7 per 1,000 children with symptoms have tested positive for COVID. And when we looked at what are the symptoms of those who test positive versus the symptoms of those who test negative, there's an awful lot of young children, particularly with runny noses only, who don't have COVID. And we know there are other things that are circulating right now that can cause that. And those single symptoms by themselves are not really a good marker of COVID versus other things. So it's a caution. It's where parents can make an assessment if things resolve, or if it's the runny nose that they have all the time and it's only that and everything else is fine, then they shouldn't be excluded from school for that reason. And it is different for children than it is for the symptoms that we're seeing in older children and in adults.
Next question is from Tim Ford, Victoria Buzz.
Good afternoon, Dr. Henry. I just want to keep going on this thread about symptoms with children in particular, and the possibility of maybe overlooking something. Are you at all concerned about the possibility of a parent self-censoring in the opposite way, that is to say, saying they just have a runny nose, sending their kids to school, and it turns out they did have the virus? And if that is the case, and we experience an outbreak, would you adjust your criteria and your guidelines?
Yeah, so I think what we need to think about is this is all based on data and information that we have that's ongoing. And so we have seen that there are children, lots of children in our schools with runny nose, just for example, that don't have COVID. And yes, there may be one in a 1,000 that does have a single symptom, but that would be very unlikely. And we would know how to manage it. If there was somebody who was detected, we know that it usually manifests that at some point somebody will have symptoms and need to have a test. And that's what we've been seeing. We see that happening, we recognize it, and it's making sure that we're not excluding children from school, lots of children from school, for reasons that aren't risky, aren't related to COVID.